most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Torn ACL surgery. Want best success? You must see this. Listen to us now, and we'll tell you later.
Well, yeah, there's some good information here from science, recent science on when to start in certain parts of the protocol and when not to if you want to have long-term success.
A lot of studies.
Right.
A lot of things have been referenced here. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media channels.
Yeah.
Brad, go to work here.
Yep.
Instagram, Facebook. We're always giving something away. If you go to our channel, our website, Bob and Brad, you go to giveaways. We're giving something away. There's always a contest going on.
Right.
And you'll see it on our YouTube and on Facebook too.
Easy to sign up for, and you know, we definitely, you know, people get this stuff.
That's right. We're very generous.
Okay.
With other people's products.
Yeah. ACL, first of all, we're going to start from ground zero and kind of go up. ACL ligament. There's a lot of people that really aren't familiar with it unless you injure it. Even then you may not know, but it stands for Anterior Cruciate Ligament.
Right.
So it's in the knee. Anterior means front of the knee.
Right.
The ligament itself isn't in the front of the knee, but it prevents the tibia from moving forward.
Yep, that's this bone right here. This bone right here,
Yep.
It prevents it from translating this way.
Right, in the forward direction. Cruciate. You know what cruciate stands for?
Cross, right?
Yeah, two ligaments that cross.
Yep.
So the ACL and the PCL cross, make a cross in the middle of your knee, so to speak. So there you go. And of course, ligament is a structure. Now, along with this, so we know where it is. Like here, you have to lift up, get the patella
Out of the way.
And there we got meniscus in there. And actually, they have the ACL in
yeah,
there.
they do have it in there.
Sure. Now,
Wow.
good old Sam, huh?
Yeah, we didn't even know it was in there.
Yep.
Can you see right there and right there, the cross?
Are you zoomed? Yeah.
Oh, she's got it. Good.
I wish they had that in a different
It's
color.
usually, just as an aside, it's usually a kind of a devastating injury.
Right.
Yeah,
well, I wouldn't say devastating.
Well, it's devastating if you're an athlete. It takes a long time to rehab.
Right.
From it.
Oh,
Yeah.
then that way for sure. But, you know, people can live without an ACL.
Right.
Your knee is not as stable. It's not desirable.
Yeah, it could lead to like premature osteoarthritis.
We don't even want to go there. But how do they figure out if it is torn? There's a couple ways. First of all, they'll do some manual testing. The therapist and the doctor, the orthopedic doctor, they'll do, you know, the anterior drawer test.
Right. Anterior drawer test.
Yep. And there's 2 or 3 tests, and it depends. I've been to a doctor. You know, I thought he was going to test my knee, and he only did one. I was kind of disappointed.
Oh, sure.
He said, go get an MRI.
Oh, really?
Yeah. So the MRI was probably the big one that they're going to look at so they can see that soft tissue and, you know, confirm that ACL is torn.
And to see what other structures, because often if the ACL is torn, something else may have been torn along with it, the medial collateral or the meniscus may have been damaged too. The terrible triad, as they call it.
There you go.
So,
so the MRI is typically the preferred scan. And then once you've confirmed you got an ACL tear, you're going to go talk to the surgeon. You know, don't start talking to other people that had theirs done or this or that. You need to go to someone that looked at your MRI and is familiar with it. And if they say they recommend an MRI, they may give you a couple options of how to repair it. Okay, they may replace that with an autograft. So that means your hamstring tendon, there's a hamstring repair, or they take the tendon below the patella, your kneecap, and your tibia, they cut 1/3 of that out, and they may use that method.
auto meaning, again, you're using your own body parts, basically.
Precisely.
Yeah.
Or you could use the allograft, which is a cadaver. In other words, they harvest a tendon from a cadaver.
Right. Someone who's died.
Someone who's died, they take that part of their body. And so that can be a psychological thing for someone. But you talk that over with your surgeon and decide what's going to be the best for you.
Sounds good.
Now, once the surgery is done, you know, then you've got a number of months ahead of you to get ready to get back into your activity. First of all, there's a part in time where after surgery, you're going to work on range of motion with therapy. You're going to eventually work on strengthening after a number of weeks. But there's a point in time where that tendon, that new tissue actually starts to die off a little bit. And after about between 6 and 12 weeks, there is a point where it's very weak. And what has to happen is it has to get revascularized, which takes weeks.
It has to create its own blood supply.
Right. And then once you get blood supply into tissue, then it can start to become stronger and respond to therapy much better.
So there's that critical point where you don't want to damage the tendon, and you want to make sure you promote vascularization.
Right. And they're kind of vague on this, but between 6 and 12 weeks is definitely that
crucial period.
Right. That's where you want a therapist to follow your symptoms and guide you through this in a particularly right manner, so you have successful rehab.
Exactly.
So then, once you get, typically after 12 weeks is when you're going to start strengthening and you're going to start doing some activities, but in a real structured, regimental manner. You know,
they generally have like a protocol that we just follow. It goes right along, and you know, obviously some physicians or surgeons have their own protocol, but I mean, you need to follow what they're suggesting.
Right. The surgeon and the therapist are working together. They communicate in one form or another, so they keep you at that precise level so you don't injure it. Now, they can go up to, after you get the revascularization. Yeah, I need that speech therapist. There's that remodeling phase and then the maturation phase. In other words, when is it complete? And studies show up to 2 years, 24 months before it's completely healed.
Wow, ligament takes a long time to heal. It's a tough fibrous material, so it takes longer.
Right. And so the biggest mistake, and they mentioned a study. Now, when I say they, I took a continuing ed course through a gentleman at Stanford, and he was just labeling off the studies after study after study to support all this information.
So he did all the background work on this. I mean, he did, and he looked at all the studies, which there are hundreds probably, right?
Right. Oh, he narrowed it down to some of the
the more
recent and the more prominent researchers. And one of the biggest mistakes that someone with an ACL can do and happens when they re-injure it is they go back to the sport too early.
Sure.
And the number that they picked was never to go back to the sport before is 9 months. If you're not at least 9 months out, don't go back.
And you'll see that on the pro, NFL players. I mean, they're never back before 9 months.
Right.
I mean, they always talk about a year time. In fact, sometimes it's less than a year. But so I think obviously where money's on the line, they're being extra careful, and they want to make sure you can tolerate it.
On the other hand, they want to get them back as soon as possible.
I know they do, but they don't want to re-injure.
And that's the same with most anybody. You want to get back to your activity as soon as possible. And usually by 9 months, you're feeling pretty good. You're walking pretty good. But they talked about quadricep strength. And he said quad is king. You want to have a really strong quadricep. And after an ACL, the quadricep will atrophy.
Oh, atrophy, sure.
It'll shrink right up, and then it takes time and a lot of dedicated exercises.
It's funny, I have a patient right now, and he really has had difficulty with his quadricep.
Sure.
I mean, we are just focused on it because it just had done, like you said, Brad, it had atrophy to the point where, I mean, he could hardly even sit down without it collapsing. You know what I mean?
So that's it. There's an hamstring strength, which does help support the ACL. You want to get that going. So this is something So
the biggest points you're taking away here, Brad, is one, don't go back to the sport too soon, 9 months. And two, you really got to get that quadricep strength under control. And I'd say three is there's that critical period between 6 and 12 weeks where you really want to be careful with the knee in that because revascularization is taking place.
Bob, you are excellent.
I've been paying attention. I've been paying attention.
So again, this is something you're not going to do on your own.
Right.
You've got to
be guided.
Yeah, you got to go to a therapist, take your time, and just be prepared for this time to go through before
And then the therapist at the end, he's going to do functional testing that you have to pass before you go back to the sport.
Right.
And so they know that you're going to feel confident because that's part of the problem with an injury like this. You don't trust the knee anymore.
Right. And you got to get that guidance. There's a number of tests to go through. There's the jump test, the hop test, the left test. Are you familiar with that one? It's very aggressive.
No, I don't know that
Lower extremity functional test. George Davies actually made that up.
Oh, he did?
Yeah, he's very big in the knee in the therapy world.
Brad studied under George Davies, right?
Yeah, he was my
one of
my
the
professor,
instructors.
my instructor for a couple
Notable therapist in the field.
Right. Yeah,
Oh.
he's known all the way across worldwide, actually.
Sure.
So take your time with the ACL. Do more homework and listen to your doctor, listen to your therapist, and you're going to have good success.
All right. Remember, Brad and I can fix just about anything.
Except for
a broken heart.
There you go, Bob. But we're going to work on that as well.
We're going to work on it day and night. Thanks for watching.